it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
Thanks, Sarah. And good to see you guys all. Look, you're all comfortable at home at least. At least it's a bit cooler tonight. We've got a good topic for you today. Jackson, if you could share the presentation when you're ready. We've called it Battling Bursitis because we know it can be a battle. You know, it's quite a tough sort of condition to treat. Often people have it for quite a while, and it's something that can be quite troublesome to get rid of.
As Tim was mentioning, we'll be covering bursitis of both the shoulder and the hip, going over some of these topics as these are very common conditions that we see in the clinic. Now, but just to introduce the topic to start with, we'll be talking a little bit about this as an agenda. So we'll be covering what actually is bursitis, things that might cause bursitis, common types of bursitis, and then we'll be going into two areas, both the hip as well as the shoulder, and then we'll be closing off with a bit of a question and answer thing at the end. So feel free to use the comment chat in the Zoom. If you have any questions, feel free to just pop them in and we'll be addressing those as we go on. Now, start off, let's put this out to the crowd. So out there, people, I'm sure there are some people out there, I can see some familiar faces that I know have experienced bursitis. How many of you have experienced different areas of bursitis? So whether this be in the hip, the shoulder, knee, hand or wrist, foot and ankle, elbow, other, or whether or not you're just here to just learn a bit about bursitis. So you might have seen a poll pop up on your Zoom. So feel free to put your responses in and we'll let that come through. And we can see that as the results are coming, you can definitely see a large proportion instantly straight to the shoulder and hip, which is two of the big areas that we'll be covering today as well. Got a few people with the knee and the foot, two with the elbow. And it's good to have those people who don't actually have bursitis, but are just here to learn a bit about the journey with us. So this is some of the results that have been collated. 39% with the shoulder, 55% with the hip, compared to other areas. So in light of this, we'll be covering some of those topics today. Now, starting off, what is a bursa? Now, bursa, they're essentially just fluid-filled sacs throughout our body that act as shock absorbers and lubrication. Now, one way to think of it is you can think of it like a tiny cushion that helps to reduce friction. Now, the positions where these bursas are placed throughout our body are typically at areas where there tend to be a bit more friction. So things, places like between bones and tendons and ligaments, and they're just there to act as like a bit of a bubble wrap. Think of it like bubble wrap that surrounds us. Now, one other way to think of it is like an airbag. Just like an airbag in a car, it's there and we all have it, but then when we may overdo something or when we may aggravate it, they might suddenly inflate and cause a bit of discomfort around the area, but normally are there to help and protect us. Now, breaking down the word bursitis, what actually is bursitis? So breaking it down, you have bursa and the itis. Itis, the bit at the end, refers to simply just inflammation. And bursa is, like we've just discussed, a fluid-filled sac that helps to cushion things around the body. So putting them together, it's just an inflammation of the bursa. And if you were to look at it on an ultrasound scan or an MRI scan, it may be commented on as simply thickening of the bursa. Now, it's interesting to note that also in all of us, we have about 160 bursa throughout the body. So these vary all around the body, and we'll be going into some of these today. Things that might cause bursitis, repetitive movements. So repetitive movements and overuse kind of activities can create a lot of stress and a lot of tension on these areas of bursitis, where the bursa are, and can typically create a lot of stress on the bursa, causing inflammation. Now, this can result in pain once patients end up going into certain ranges. But a lot of the time with the repetitive movements, say, for example, if, say, a baseball person was to be able to repetitively bowl a ball, or a cricket player was to be using their hand a lot in that overhead type of movement, it can create a lot of shoulder problems if they're not looking after it correctly. Things like muscle imbalances or biomechanical problems. So with muscle imbalances, you'll find that, say, if I was to say, for example, the hip, if people can get bursitis, if people can get imbalances with the muscles around the hip, so your gluteal muscles, they might experience a change in how they walk. And with this, it would end up creating a bit of imbalance in some of the muscles. And this would place extra stress on the bursa as well. Last of all, things like underlying medical conditions. So things like rheumatoid arthritis or different inflammatory conditions can also predispose people to be more at risk of bursitis. Other conditions can include things that can create crystal deposits, such as gout, that can also predispose people at more risk of bursitis. Now, moving into our first area of focus, the hip. So, types of hip bursitis. You can see within the hip alone, there are a few. So things like, and I've listed them in order of most common to least common. So there's the trochanteric bursitis, the ellipsoid bursitis, ischial bursitis, and septic hip bursitis. But for the purpose of today's, we'll be focusing just on trochanteric bursitis, which is by far the most common one in the hip. Now, going into trochanteric bursitis and talking a little bit about how one might present. So people with trochanteric bursitis typically tend to have pain around the outside or the lateral side of their hips. Sometimes this can even refer pain a bit further down the leg, so down the outer thigh as well as the knee. But the most focal point tends to be on the outside of the hip. You can see on the diagram there, right where there's the most bony prominence on the side of our hip, the outermost point of our hips. And this is where often it's tended to touch. That landmark is known as the greater trochanter, the most outmost part of our hips, and can be one of the easiest diagnostic tests to use, having a feel down the sides of your hips. And if that's sore, that might be a sign that you have trochanteric bursitis. They can experience pain with other activities, so things like lying on your sides, lying on the unaffected side as well as the affected side, and we'll be going over a bit of that as well in a sec. Pain on cross-legged sitting, pain on prolonged sitting, as well as pain with weight-bearing activities if the severity of the bursitis is that high. Now, looking into risk factors and causes, there are a few things that can predispose people at a little bit more risk of trochanteric bursitis. So as we know, things that can cause these kinds of things are the repetitive motions. Repetitive motions, sometimes direct trauma, can also create a bit of tension along the muscles and also inflame the bursa. And as we mentioned a bit, some inflammatory conditions such as rheumatoid arthritis or other things like gout, and even infection, so things like septic bursitis. But with these kinds of things, there are also other factors to consider. Unfortunately, females are slightly more at risk of developing trochanteric bursitis, and this is just purely due to the anatomy of how females are with their hips compared to men. Females tend to have a bit of a wider hip, and their legs tend to be a little bit more what we refer to as bow-legged, which also increases the tension at the hip as well. Now, going into something that us as physiotherapists might actually have a look at in people who have suspected suspected trochanteric bursitis, we might do a simple test known as the Trendelenburg test. But all this is looking at people's ability to stand on one leg. Now, on the left, you'll see someone who's quite well, and in a normal individual, you'll see that their pelvis level, where the hips are, where that blue line is horizontal or maybe a little bit even tilted upwards. So the person standing on their left leg, and the pelvis is either quite level, or the right side, which is a non-weight bearing side, might be slightly lifted. And that's considered fairly normal. Now, when we look on the right-hand side of this diagram, this is someone who demonstrates a positive sign on the Trendelenburg test, or and this is a test to demonstrate hip stability. If they're positive, then they either have poor hip stability or weak muscles around the hips, such as the gluteus medius, for example. And this can create some of those biomechanical problems that we were talking about. Now, in this test, if they stand on their left leg, you might be able to see that their right leg actually drops, their right hip actually drops down a little bit. Now, what this indicates is that there's weakness actually of your left hip muscle around the gluteus medius, and it's not able to control the right hip and not able to actually keep that right side of the hip upwards. Sometimes people might also experience pain on the leg that they're standing on and on the outer side of the hip as they're doing this. But this is also one very quick and easy way to determine whether or not they have any sort of weakness around the hip, and help us to make the diagnosis. One thing to also note with regards to diagnosing a condition like trochanteric bursitis is that usually the diagnosis can be made just on the spot by the physiotherapist, just by having a look, and based off your assessment, we'll be able to determine if it is or if it isn't. But sometimes if we're unsure, or if treatment is going a little bit unexpected, then we might ask for a scan. And then things such as an ultrasound or an MRI scan will also show this on a scan as well. Unfortunately, this won't show on things like x-rays, as x-rays are more designed to look at the bones as opposed to soft tissue such as bursa. Now, this is a very, very handy table. Now, essentially, this table will go over things that might aggravate people with bursitis in the hip. It'll cover why it does it, as well as a simple solution that you might be able to utilize to help to alleviate things. So looking on the left side and going through them. So lying on your painful side. So when we're lying on our painful side, that direct compression as our mattress, as we're lying on the bursa and compressing that into the mattress, can be quite aggravating. One of the solutions around this is we can add a soft mattress cover. Some of the things that I might suggest to patients, if that's their only position that they can sleep in on that affected side, and habitually they have always been sleeping on that side and can't change, then we might even suggest something called like an eggshell mattress. Essentially what this is, just like the name suggests, it looks like an eggshell carton, and it's something that you place on top of your mattress to help to divide up the pressure so that it doesn't just stay on the outer side of the hip, but distributes it out. Now, some of the easy solutions you might think is, why don't you just turn around and lie on the other side? Now, sometimes this can also be a bit tricky as well. Now, you can see under why does it aggravate, it mentions the upper leg adducts causing compression. Now, what it means when it says adducts is that adduct is when our leg crosses the midline of our body. So if you imagine activities such as kicking a soccer ball across your body, or if you're lying on your side and the top of your leg comes down, that action where it's crossing the midline of the body can also create a bit of compression on the bursa. One of the solutions to this can be placing a pillow or a cushion between your knees, which will help to even out the legs a little bit so that you're not creating as much pressure on those areas. Hip hanging or in standing position. This might be where people are placing excess pressure on one side of the hip and causing the hip to stick out a little bit, which will increase tension along the outer muscles of our hip. Once again, increasing the compression around the bursa and also creating weakness, which is some of the biomechanical side of things. If our muscles are a bit weak, it also puts us at high risk of bursitis. Simple solution, don't hip hang. Sitting with legs crossed, once again, also increases the compression along the outer side of our hip and creates that movement where our leg is crossing our midline. Once again, this one is a little bit harder because it's a very habitual thing, but try not to cross your legs and try to catch yourself doing it as much as you can and stop yourself. Sitting in low chairs. So when we sit in a standard chair, most of the time our knees will be in line with our hips. But if you're sitting in a bit of a lower chair, your knee height might actually be a little bit higher than your hips. Now, what happens here is that it increases the pressure sometimes that we're feeling through the outer side of our hip and can cause pain when we're getting up from a sitting position. And one of the easy solutions with this is to be able to sit on a taller chair. If you don't have a very tall chair at home, simply you can put cushions or pillows on the chair so that you can try to boost yourself up. This will decrease the pressure that it has on the bursa, but it will also allow people to have less discomfort as they're getting up off a chair. Last of all, things like standing on your painful leg or weight bearing on that side during activities. So say, for example, if you're putting on your pants or if you're putting on your socks and you're doing that in standing whilst you're standing on one leg, can sometimes be quite painful. And that's because with the Trendelenburg sign that we just talked about, where the hip is dropping, it increases pressure on that side and hence causing compression on the bursa. Now, a simple solution there is to be able to use some support. So instead of doing those activities in standing, you might actually do them in sitting instead, so that you can give yourself a little bit of a chance to rest so that you're not putting so much pressure on the leg there. Now, as we're moving into conservative management, you'll see, and I'll go over the different types of management strategies here, and then a little bit of the non-conservative managements later. But in the conservative management, this is where myself and Tim are involved quite heavily in as physiotherapists. So we might do things like manual therapy. So for example, things like trying to release the muscles around the hip if they're a bit tight. And this will often help with the pain relief side of things, helping people to move better so that they can try to do more in their day-to-day or exercise a bit more efficiently. One of the things that we also might look at is activity modifications. So for instance, such as that table that we looked at in the slide prior to this, trying to modify the activities that you feel are necessary. One thing I didn't, so looking at modifying activities in that sense. One thing also to bear in mind is your weight modification strategies. Now, if someone was to have a sudden increase in weight for whatever reason, this obviously will increase the amount of pressure that ends up going through the hip as well. So making sure that with our weight, we're trying to manage that as appropriately as possible to try to reduce the pressure on the hip as well. Taping is another strategy that we can use to try and reduce some of the pressure along the outer side of the hip, if that's a problem. If the muscles around the hips, such as the glutes, are a bit weak, we need to try and target the muscles around that as best as we can. And more often than not, it's not just the glute, it's around looking at some of your muscles around the thigh, some around the back, looking around the area as well, and making sure that all the muscle groups around the area are working well in order to help us walk efficiently, go up and down stairs effectively, and do as much as we can there. As things are improving, in the longer term, then we'll start to look at making a referral to someone called an exercise physiologist. Now, these are awesome guys that get involved towards the end of stage rehab as pain starts to get a bit less problematic and people are more looking at returning to their day-to-day activities. Now, what they'll do is they'll look at things on more of a zoomed out approach as opposed to us physios. They'll look at things a bit more zoomed out, try to look at how your muscles are working on a global scale, look at things on a more functional level and help you to be able to achieve your goals. Not only that, but being able to help to maintain muscle strength that way can also help to prevent this problem from coming on again. Other treatment recommendations that are available. Now, some of these recommendations we need to bear in mind are just short-term strategies in order to help to achieve pain relief. However, sometimes this is necessary because if people are in so much pain that they can't exercise or they can't move very, very well, then it can be quite detrimental to how they're moving around, which doesn't help with the bursitis side of things. So sometimes we need medications. So this can be things like non-steroidal anti-inflammatory drugs, or NSAIDs for short. But this would be around having a discussion with your doctor just to make sure that this is suitable for you and it's not interacting with any other of your medications that you may be taking as well. Once again, the injections, so people can get cortisone injections, as you can see in the diagram. You can get an injection straight into the bursa, that fluid-filled sac, and this will help to reduce the inflammation around the bursa, temporarily helping to relieve the pain. Now, with these kinds of things, like I said, it's a short-term strategy to help to relieve the pain. If weakness or tightness around the muscles is causing some of the problem to start with, unfortunately, these won't help to address that. So it will just help to alleviate some of the inflammation of the bursa. So once the effects of the medication or the injection wear out, unfortunately, if the weakness is a problem and you're not addressing that, the problem is likely to come back again. So it is important maybe just to use these in tandem with exercise and use it in conjunction so that you can try and combo the two as best as you can. There are other methods of treatment out there. For instance, people might look at PRP injections. One of the things, people can look at acupuncture, but the research around that sometimes can be a little bit mixed as well. And if people do achieve relief, can sometimes be a bit more on the short-term relief side of things. But generally, exercise is seen as the main mode of treatment to start with. And as a last resort, operative management is a consideration, but this is very, very rare and only in patients that have chronic symptoms that have not responded to any of the conservative treatments that we've tried. Now, I'll hand it over to Tim, my colleague, who will be covering a little bit more about the shoulder side of things.
Yeah, Tim's back, so that's the first win. But I think maybe we'll just break here just for a sec. And I know that there's no sort of big questions just yet, but I guess this is a chance for anyone. If anything Jackson's gone over, you'd like more detail, or if you've got any experiences related to how you've managed, I guess, your hip bursitis, feel free to pop it in the chat. But Jackson, I thought I'd ask you, you know, the table that you showed that had some of those relieving strategies?
Yeah.
So things like, you know, the mattress and standing in different positions. Do people need to do that forever? Like, is that something that you'd recommend? Like, if you get diagnosed with a hip bursitis, is that a short-term thing, or are those the sorts of strategies that you think people can use for a long period of time? What's your take on that?
Yeah, great question. I think these are very much only temporary things whilst you're in the process of rehabilitation. It's important to note that with all of these kinds of things, these are only means of trying to adjust your lifestyle to work on the decompression side of things, to allow the bursa to calm down, to allow the muscles to strengthen. And once those have all come back, yeah, all of these activities should start to come back. So going up and down stairs, going up on hills, and then returning to your lifestyle, whether it be playing sports, whether it be hiking, doing all the things that you love there.
Perfect. Okay. And I guess Caroline's just asked, and I'm sure this is a difficult one to answer, but in your experience, like, let's say this, you know, someone starts getting some pain, they go to their GP and they receive a diagnosis of, you know, bursitis of the hip. And let's say they've only had pain for a couple of weeks. How long have you found that a bursitis can tend to last? And maybe you can give a few examples. You know, if someone gets in front of a physio or gets some treatment, it might be one answer, but then if they don't, or for whatever reason unable to access treatment, what's been your experience with the time frames?
Yeah, great question. Very tricky question to answer in the sense that people present with various levels of severity as well. And once again, the age ranges will also affect how we recover. Unfortunately, younger people tend to recover faster than older people. But as a very general broad thing, if someone has had outer hip pain and it seems to be presenting as bursitis and has had it for maybe a few weeks, with all the right things, with exercising, adjusting your lifestyle, doing all the right things, it might last on about that 2 to 3 month time frame is what I would be expecting, with treatment, trying to make sure that you're looking after yourself. Going back to that cortisone injection that I was talking about, people might be able to experience on that also varies, but maybe about 2-3 months sometimes worth of relief out of that. So sometimes as the effect of the cortisone is starting to lower, but hopefully as their strength is increasing, because the cortisone has allowed them to move around and exercise a bit more confidently, then that as the cortisone comes down and the strength moves up, they won't really notice the effects of the cortisone being there anymore. But yeah, I think without the exercise and without the movement side of things, this can quite often turn into a bit more of a chronic problem, and sometimes won't actually go away until you do something about it, adjusting the lifestyle, trying to do the right thing. So I think it's very important to look after these kinds of things as soon as you can. Obviously, the sooner you get into it, the quicker the prognosis and how long it will take to recover. But yeah, sometimes chronic things can take a bit longer.
Yep, that makes sense. So I guess in summary, you're firstly really trying to do whatever you can to help reduce pain and to help reduce the compression of the bursa. And I guess Tim will take us through whether it's any different in the shoulder. I suspect not, but yeah, you really want to get that going first, and you can hit that with a number of different strategies. Then you've got to try and really tackle the strengthening and the exercise stuff, which it's unfortunate, and a lot of the things we talk about here all end in exercise being necessary, unfortunately. But I think it's a good reminder, I guess. And obviously we can go into more specifics as to what that might look like if anyone's interested. So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. Otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.